Today we have Dr. Tim Shannon. Tell the audience a little bit about yourself.
Yeah, so I'm a naturopath in practice since 2021. Have done a number of different kinds of treatment modalities over those years. Probably the whole 23 or so years, I've been using something called homeopathy for treating patients, but then also I did a number of years of doing intravenous therapy with many cancer patients. But then our clinic IV therapeutics have become prohibitively expensive and challenging for a number of reasons. So our clinic stopped allowing IV treatments probably 8 or 9 years ago. And then I also treat a lot of cancer patients using an array of different kinds of off-label drugs and supplements trying to target their metabolic vulnerabilities. And then probably my day-to-day practice, I see, your migraines, your insomnia, your anxiety patients. They're the day-to-day patients. And then I also have a lot of chronic, what's referred to as complex multimorbid patients, which has now become ubiquitous. There's probably 50% of my patient base are patients that have 3 or more chronic health complaints.
I know you mentioned that you're a naturopath. A lot of people get that confused, and they also get herbal medicine confused with homeopathy. So can you just touch on the difference between the three, please?
Well, naturopathic medicine is sort of an umbrella kind of alternative provider in the United States, and they also have naturopaths in Europe and other countries, I believe, although there may be some differences between the United States and those European countries. In this country, we have licensed naturopaths who go through a 4-year medical education, and we have to do like cadaver lab, and we have to do pharmacology, and we have to go through training that's very similar actually to what the conventional medical patient or physician goes through. Probably the biggest difference between a naturopathic healthcare provider or physician and a conventional provider is the application of treatments. So in the conventional world, oriented towards symptom resolution using surgeries, many different pharmaceuticals are probably their bread and butter, and radiation for sure if you're cancer treatment, and then there's sundry other treatments around that, but those are the bulk of their interventions. In the naturopathic realm, we're using treatments like supplements, herbal medicine, homeopathic medicine, different kinds of manipulation, craniosacral therapy, acupuncture, Ayurvedic medicine. I mean, there's a pretty broad array of different tools that naturopaths can use depending on their own particular inclination. And then in the naturopathic realm, you can devise treatments into different subtypes. So you have treatments that also are mostly going to look at symptom resolution. And I'd say that's a large portion of naturopathic care as well. Meaning if somebody has acute pain or something, a naturopath may prescribe an NSAID like ibuprofen, or they may prescribe an herb that they know well, or a series of herbs, or a mixture of herbs, or they may prescribe anti-inflammatory proteolytic enzymes, things like bromelain, serrapeptidase, different enzymes that chew into inflammation, or they may prescribe high doses of omega-3 fatty acids because those will often blunt pain or inflammation. So even though they're natural agents, they're meant more as a in the moment or acute use to resolve symptoms. They have some similarity with the conventional world, except for you're using natural agents to try to get the same benefit or similar benefit. And then you also have another whole subset, which is called diet and lifestyle medicine, which is that many patients that struggle with chronic disease nowadays, one could say their health complaints are fed unbeknownst to them, by a poor diet or being sedentary too much. It's a huge part of medicine is diet and lifestyle medicine. So that's another subset, is talking about people's blood sugar and their metabolism. And that's often done in a way with naturopathic care, which can resolve chronic complaints. There are many chronic complaints. I mean, diabetes is an obvious one, but there's an array of many other chronic health complaints that patients suffer from. If they're well counseled and in their diet and lifestyle challenges and use blood work to help kind of anchor where some of the problems are, a lot of people can be relieved or at least significantly relieved of chronic pain, depression, just so many different chronic issues. Having said that, I don't want to suggest that diet and lifestyle is the cure of everything, because it's not. Oftentimes, chronic diseases can become pretty complex, and the system can kind of get on board to kind of keep things stuck, and then you need something more precise to really resolve those chronic ailments. And then there's treatments that are meant to induce the system to heal itself, like homeopathy, acupuncture, Chinese medicine, or Vedic medicine to some degree. I suspect I know less about Ayurvedic medicine. But those treatment approaches are meant to correct imbalances that get sort of stuck in the system. And once those imbalances get stuck in the system, you need something to induce the system to break from that stuck pattern back to normal balance. Attention deficit disorder, or ADD, which is now super common in today's society in children and adults. And in the conventional world, they're pegging the whole condition to genetics or neurological problems or some kind of physical phenomena. I would suggest that there's other ways to look at things like ADD. For instance, one of the things we know, if they're saying that it's genetic, then you can look at a population of poor or disadvantaged people, children, for example. They've done many of these studies and compare them to privileged children of the same age group. And what you see is a wildly higher incidence of ADD and ADHD in the poor group versus the other group. And how come that's true if it's just genetics? It doesn't make sense. The environment and the milieu that we're born into can have a profound crafting effect or training effect on our ability to maintain good attention or focus. For instance, you take any young boy or girl, and let's say you put them in a home where there's, it's a reasonable family life. But in that family, 2, 3, 4 times a week, the parents are in a loud brawl or row or some kind of argument, and that child, boy or girl, is sitting in their bedroom or sitting in the living room listening to them yelling and screaming at each other. And they may be the most loving parents who are very good at providing for the kids, and they got good schools and all that. But those children in that house, they can't turn that off. They can't leave. They can't select new parents. They have no agency to change their context. And so if that's very uncomfortable for that child, which makes some sense that would be, one of those kids might look out the window and start spacing out, because that's a lot less uncomfortable than tuning in and hearing all the words and so on. And so it doesn't take a lot to assume that child, if this is happening regularly, that child trains themselves in how to space out, such that when they go to school for their first year and there's a lot of noise and there's kids screaming and whatever's happening in the school, they now have trained themselves to space out, and now they're in this place where they have to sit down and focus, and now they're at odds with themselves. Yeah. Now, somebody's going to tell you that's just a genetic proclivity, but when you see the high level of these kids now being put on ADD drugs, I think it could be argued there's a lot of those kids that have already been sort of pre-trained, and now their nervous system is sort of trained or entrained into that way of focus. And something has to break that pattern. If something doesn't internally break that pattern, You can use stimulants, you can use Concerta, you can use Ritalin, you can use those drugs, which force the child to hyper-focus only while the drug is active in their bloodstream.
Yeah.
But once that drug gets metabolized, then Johnny or Susie is back to jumping all over the place and can't focus, because that drug is not meant to fix or correct that imbalance at all. It's not even the purpose of it. The purpose of it is to manage the issue. And this is not knocking those drugs. There's a lot of people who use them and find that they work in adults or children. It's just that they have a significant limitation that's rarely discussed, which is that you're never fixing that imbalance. And homeopathy has a very high success rate in actually resolving the problem, such that most of the kids or adults that I see have these kind of focus or attention issues in somewhere between a 2 to 6 month window. They're not only resolved of the focus and the behavioral issues and the like, we can stop treatment and those improvements remain. And that's a very different approach to something where in some kids, a lot of kids, they're on the drug until they're an adult. And you can imagine that's not going to have the greatest effect on their self-esteem because they feel like they're not normal unless they're taking a drug. And I don't want to make it sound like homeopathy is the only option. There's other treatment options out there, like craniosacral therapy. You can see a really successful craniosacral physician. They can also break that pattern and allow the child or the adult to reset their nervous system such that they can stay focused. Exact same setup that I just described works wonders for chronic pain syndromes, which also become reiterative pain signals that the system can't get itself out of, migraine headaches, sciatica, just so many different conditions. Using homeopathy, you can induce a restoration to normal function. And certainly even, I'm not saying it's magic and works perfectly with everyone. There are challenging cases and some failures for sure. But day to day, it's routinely effective in my practice and in many of the physicians that I teach using this method. I don't think it's so much symptom or root. I think it's both. I think, because the patients that I see, the parents often report within 2 or 3 weeks of starting a good medicine, they already notice a 15-20% improvement in overt symptoms. Probably one of the big differences, though, is if that same child is doing really well on like Focalin or Concerta or Strattera, oftentimes the parents will notice a significant improvement in focus and concentration within a few weeks, like a 50, 60, 70% improvement in symptoms. It's just that they can't have that kind of benefit without the drug. But using the homeopathic approach, it's more incremental. So over several months, the patient will reach that level of efficacy. But then once you see that 80, 90% improvement in focus and behavior and the like, you can then start drawing back the homeopathic medicine and the improvements remain exactly the same.
Wow.
So it's a different trajectory of treatment and a different purpose, a different intention. And sometimes the patient is doing, maybe their ADD symptoms are 50% better, but their aggressive behaviors and other symptoms like problem falling asleep aren't really affected by the Focalin or the Ritalin. So in many of those cases, I just tell the parent, you can maintain the Focalin or the drug for whatever benefit it does, and then we'll address, using homeopathy, the other remaining symptoms. And once those are clearly improving, then we're on a platform where it's not a big deal to back them off the drug, because now we've already seen evidence that the deeper nervous system issues are already repairing. So you don't have to be off drugs or on drugs to succeed with homeopathy. Cancer, like if you consider cancer versus non-cancerous cells, non-cancerous cells are healthy cells, have an ability to respect the boundaries of the cell wall, like they respect the neighborhood, you could say. So when there's a cell in a healthy neighborhood of cells in your eye or your arm or wherever, or in your organs, and it's starting to grow too large, then there are sensors that inside that cell, that it can feel the pressure of the sensor surrounding it, and then it will use feedback to either fix itself or to even kill itself. So it has, because cells are replacing themselves all the time. We think that we're the same all the time, but many of our cells replace themselves within months, depending on which cell type it is, the liver, the bones, etc. It's anywhere from weeks to, I think 7 months might be bone cells. So each of the cells are constantly replacing themselves. So that means they have programs and instructions to make the cells die off so that new cells can replace them. But that living healthy cell has the capacity to communicate with the neighboring cells around it and coordinate. Whereas a malignant cell, and it also has a very efficient form of feeding itself. And so that means it can get fuel and build proteins and repair different cell surface areas and different organelles, parts of the cell that do different work. It can do all that work and is efficient in deriving glucose and other nutrients to feed the cell. So again, we're assuming a healthy cell. So when you take a cancer cell, that cancer cell no longer communicates successfully with surrounding cells. So that's one characteristic that's unique. So in other words, if you have a healthy colony of cells versus a cancerous colony of cells, that cancerous colony of cells can now start growing unregulated over top of and in between healthy cells and inserting itself because it's ignoring or it's lost the capacity to hear the signaling of the normal healthy cells around it, which is what scares us about cancer, is because it can grow at such an incredible rate, or even just a slow rate, but it can overcome many of its neighboring cells and cause damage to the liver or the pancreas or the lung in such a way that, now the patient has problems breathing or their liver function starts to decline. So that's one aspect. The other aspect is because a cancer cell uses a metabolic process that's very inefficient, it can consume huge amounts of energy that the whole system needs to survive, and therefore cause the patient to become very weak and drained. This is more towards the end stage of cancer when the cancer is really taken over. But metabolically, because all of those cancer cells are so inefficient, they're just draining the life force out of that patient, and then can put that patient in end stage cancer into a state called cachexia, which is a form of malnutrition where the patient completely loses their appetite at the same time that they're losing skeletal mass and they're becoming profoundly weakened. So cancer has, these are very crude estimations of the difference between a malignant cell and a non-cancerous cell, but this gives you some kind of broad ideas. And the other challenge with cancer is it can be growing inside someone, and this is not uncommon. It's an insidious process where someone can be slowly having a cancer of the colon, for instance, and not know it until the cancer is so large that they have some constipation or diarrhea, and they're lucky enough to see a doctor who orders a test, and the test shows, oh my God, something really weird. Then they do imaging and they see this huge mass. So that's the other scary thing about cancer, is besides its insidious nature that it can be building up, is that it can rapidly take your life. It gives you kind of a basic distinction between non-cancerous cells and cancerous cells. There's a drug called propranolol, and propranolol is a drug that's approved by the FDA, or it's on label for hypertension or elevated blood pressure. So that's what it's on label for, meaning it was approved for. Many years ago, physicians who were aware noticed that when their patients with stage fright, for instance, they took their propranolol before they went on stage, they noticed they were conspicuously absent of stage fright. And so enough doctors noticed this that now they prescribe, or we prescribe, propranolol for stage fright for people that don't have hypertension. So that's what they mean by off-label, because you can legally prescribe any drug in the United States off-label for reasons that it wasn't originally tested or approved for. I think the estimate is something like 20% of drugs that are prescribed off-label. And probably some decades ago, for instance, there's a drug called metformin. And metformin is a drug that's often prescribed for diabetes type 2, which is the more typical type of diabetes. It's a fairly benign drug, meaning it doesn't seem to cause, it can cause muscle pain and diarrhea and some other issues, but it's more on the mild side and not very common in my experience, because I've prescribed it to, I don't know how many patients over the years, more for cancer actually than for diabetes. But the drug, decades ago, an enterprising researcher noticed when they looked at the cancer incidence, so the likelihood of cancer developing in one group of diabetics versus like one group that was using metformin versus another group that was using, say, glipizide or one of the other anti-diabetic drugs, they noticed that the patients who were using metformin had a much lower likelihood of getting cancer. And so then when they looked into it, they found there were multiple mechanisms through which metformin blocked some pathways that cancer needs to grow itself and to maintain itself. So it's not by itself a cure of cancer, but because it does have the ability to blunt cancer's ability to strengthen itself or to maintain itself, it acted as a sort of soft preventative. And then subsequently, that drug I just mentioned, propranolol, also it's been discovered to block certain cancer pathways, different cancer pathways than metformin. And so now there's well over 260, 270 off-label drugs that are now identified to have minor to pretty significant cancer blocking effect. The other thing that's impressive about off-label drugs is that many of the drugs have been shown to kill what's called cancer stem cells, which is a very important topic, because in cancer you have two sort of classes of cells. You have what's called the stem cells, and then you have the daughter or the rapidly dividing cells. And so usually when you go for radiation or chemotherapy or surgery to like take a tumor out, most of those treatments are used to destroy the tumor or what you can see or what you can measure. The problem is less than 1% of cancer is actually what's called the stem cell, which is the cell that keeps making new cancer cells. And it turns out that many of these off-label drugs, metformin is one of them, has been shown to kill cancer stem cells. So using off-label drugs in an array of drugs, you don't use one, you use many to try to block different cancer pathways, not only can shrink tumors and do reduce tumor markers, but they've also been shown to kill cancer stem cells. There's a likelihood you could actually not have the cancer recur, which should be a deal breaker. But unfortunately, in our current medical world, it's not. And these drugs are also generally orders of magnitude safer than chemotherapies and the other treatments, which many of them actually cause cancer. So it's a very backwards and upside down world in the cancer world. Your point about ivermectin, you ideally, since you can't give a cancer patient 30 off-label drugs, you want to target it and supplements. And there's some supplements that block these pathways very well. You want to identify drugs and supplements that are pleiotropic, meaning that they don't just block one pathway, like 4. Because then if you put 4 off-label drugs and a few supplements, each of them block 2 to 6 pathways, you're blocking all sorts of ways for that cancer to feed itself, and your likelihood that your overall treatment success is going to be high goes way up. And one of the things that's conspicuous about ivermectin, it's been shown to block like cancer pathways. That's no joke. Curcumin has also been shown to block like 20 cancer pathways. So there's many of these compounds that if you add the right mix to a patient suffering from cancer, you can predictably cut that cancer cell's energy and ability to keep itself alive and and help it to die out and kill the stem cells. Now, some doctors are doing that alongside chemotherapy and radiation, like using chemotherapy in either small doses or in the regular doses, but also using off-label drugs to kill the stem cells. So there's many different options out there. It's a very promising frontier in cancer and cancer treatment, and probably one of the best places for people to look into it for themselves is a wonderful book called How to Starve Cancer. It's written by a British woman by the name of Jane Mclelland, who used this to save her own life twice for incurable cancers.